Our final group presentation, we will be talking about diets, weight loss, and media. We will be addressing all the popular diets and supplements and how they may be represented in popular media. This presentation will cover how popular media represents certain diets and supplements. For example, celebrities will be paid to promote certain products with a positive feedback even if they don't fully believe in it. However, they fail to disclose the dangers behind it. We will be talking about these dangers of the diets, possible eating disorders resulting from these diets, as well as any medical implications. There will be 4 main points that we are discussing. The first is celebrities and social media. It is no secret that celebrities are paid to promote certain diets and supplements. The second is the keto diet and the Atkins diet. These are both popular diets that are claimed to result in quick weight loss, but at what cost? The third point is eating disorders. Highly restrictive diets such as the keto diet or the Atkins diet can lead to development of eating disorders such as anorexia or bulimia. And last but not least, medical implications and conclusions. What does this all mean? How does this affect us medically? We know that most people who go on these diets, use these supplements, are doing so in order to achieve superficial results. But what they fail to consider is the dangers that this can present medically and the false information that can be misleading. I came across this quote in my nutrition class last semester, and I felt it could be tied to the ideas of relating medicine and literature as we've seen in many of our readings this semester. The quote is from Hippocrates and it reads, "Let thy food be thy medicine and medicine be thy food." And from what I remember, this quote was very controversial. We were required to have a debate as to whether the two should be separated, as in should food be separated from medicine, or should they be able to be used interchangeably, or should we have a balance of the two? And relating this to diets, weight loss, and the ideals from social media, this can prove to be an important discussion that we should be having.
Celebrities and social media. When it comes to promoting new products, it's no secret that companies turn to social media to be their platform. More specifically, Instagram, where 75% of their users are the ages between 17 through 24, companies see it as their marketing pull to sell anything to the impressionable young adults. To do so, they use big-name celebrities or Instagram influencers to promote their new products. According to Business of Apps, 60% of marketers will spend over 50% of their influencer marketing budget on Instagram. So what are celebrities on Instagram being paid to promote? Well, one product under a lot of scrutiny is the promotion of fit teas or diet pills. Big-name celebrities such as Kim Kardashian, Khloe Kardashian, and Kylie Jenner, who each have over 100 million followers, claim that by using these fit teas or fat-burning pills, they are able to get their flatter stomach and overall feel healthier when consuming the product. This coincides with fit tea's claims of being super easy, super healthy, and super gentle. Another celebrity, Amber Rose, even promoted a fat tummy tea during her pregnancy, which is confusing because you're not supposed to have a flatter stomach during pregnancy. Now, what these celebrities and companies leave out are the negative side effects of using such products, such as severe abdominal pains and irregular menstrual cycles. These abdominal pains can be linked to the fact that a lot of these quick fix fitness products contain laxatives to help with weight loss. Fit Tea and other companies like never claim to be a weight loss product in their facts. In fact, they claim that they will help you achieve the body of your dreams or the body that you want. All you have to do is consume their product. The dangers. The problem with celebrities promoting fast-food diet products is that it leads their audience to believe they can attain the same body by consuming these products, even if it's a dietary scam.
Majority of female celebrities are followed by young, impressionable adults or teens that are constantly being exposed to the new ideal body type: a small waist, flat stomach, and big hips, or just overall a lean/toned body. A study by the Florida House people found that 87% of women and 65% of men compare their bodies to images they consume on social media, where 50% of women and 37% of men compare their bodies unfavorable, overall causing a damper on the consumer's mental health. This allows individuals to engage in maladaptive body comparison, and if your favorite celebrity is saying they get their body this way by consuming teas or supplement, they're overall promoting unhealthy diets, which can be a trigger or worsen eating disorders. My favorite quote from our research is from the actor Jamila. She says, "Give us the discount codes to your nutritionists, personal chefs, personal trainers, airbrushers, and plastic surgeons, you bloody liars," which exposes the reality of it all.
The keto diet is one example of a dangerous diet that celebrities such as Halle Berry, Kourtney Kardashian, and Vanessa Hudgens promotes. It is a high-fat, adequate protein, and low-carbohydrate diet that forces the body to burn fats rather than carbohydrates. Some of the promises are rapid weight loss by turning fat into energy, along with clearer skin, better heart health, and lower cancer risk. However, with this diet, there are some risks, such as keto flu, because this diet limits carb intake, which makes the body use ketones and fat for fuel, leading to feeling nauseated, dizzy, or fatigue. As well as stress on the kidneys, because it reduces the amount of citrate released, not allowing it to bind to calcium and prevents kidney stones. And lastly, damage to bone health, because studies have shown that being on keto causes a loss in bone mineral density. Another example is the Atkins diet, which is promoted by celebrities like Rob Lowe, Kim Kardashian, and Alyssa Milano. It is a high in protein and fat, as well as low in carbohydrates diet. It claims that you can lose weight while eating as much protein and fat as you want, as long as high carbohydrate food is avoided. Some of the promises are rapid weight loss, better heart health, and better memory function. Although it doesn't have severe risks as the keto diet, it does come with some side effects such as weakness, nausea, and dizziness. It is important to note, however, that experts suggest that the diet can raise the risk of cardiovascular events such as heart attack and stroke, but that the founder of Atkins diet calls it a myth by asserting that carb restriction changes the way the body processes fat in the diet.
So most diets are actually really restrictive and don't really account for individual nutritional needs or individual body types. Most of them are just solely focused on losing weight and mainly through cutting calories and increasing exercise. And the issue with this is that you're consuming little food for energy and you're doing a lot of activity, so the body thinks that it needs to decrease the metabolic rate, and that's the rate at which energy is actually burnt off. So your metabolic rate becomes slower because your body is trying to conserve energy, and that actually makes it more difficult to lose weight. And examples of diets that are not very well are juicing, which is just a lot of sugars. The carnivore diet is associated with a lot of unsaturated fats, which contributes to high cholesterol. And there's not much wrong with Whole30. It places a lot of restrictions on like dairies and grains, but the issue with it is that it's so restrictive that it causes this kind of cycle. And I added this image here of the cycle. It's like you start the diet, it's so restrictive, you feel deprived, then you start craving and you give in and you start feeling guilty and you try the diet again. But it's sort of a cycle that happens with such diets, is that it's so hard to stick with it, and a lot of people do turn to more severe measures because of this, because they feel guilt at not being able to stick with diets. So here are the two of the most well-known eating disorders is anorexia and bulimia. So I spoke in the previous slide about a slow metabolic rate, and this makes it harder to burn off energy in the form of calories because your body is trying to conserve that energy since you're eating less. So it's like, again, it's like a cycle. Like you get a slow metabolic rate, it's harder to burn off energy in the form of calories because your body's trying to conserve it. And as a result, a lot of times people think they need to eat less because as soon as they start eating again, it's harder to lose that weight. It's easier to gain that weight because your body is trying to conserve the energy and it doesn't lose the calories. So it leads people to believe they need to eat less. And then again, your metabolic rate becomes slower, harder to burn off the energy, and they think they need to eat less until eventually they become to the point of being really malnourished. In terms of bulimia, a slow metabolic rate also means that you get an increase in hunger. So this often leads to binge eating to the point of purging. So that's kind of the theory behind bulimia. So eating disorders are often triggered by cultural and social factors, though also some environmental factors such as availability of food to you. But for the sake of the topic, we'll just discuss cultural and social factors. So eating disorders are often really, really common in families that are worried about success or public image. And a lot of this is because slimmer body shapes are among the most advertised as successful, especially in media, magazines, TV, photos, photo shoots. Like you see models are expected to be a certain type of weight, and a lot of times they're criticized for being over that type of standard. And actors and actresses in successful films and shows tend to be on the slimmer side. And thicker actresses do appear a lot. And sometimes it's not the case, but a lot of times you see them in comedy films. So it's really damaging to a person's self-esteem when they're trying to accept being a little bit overweight, when a lot of the times it seems that body type only appears in media for comedy. So eating disorders are also common in families concerned with fitness. So the typical representative for a healthy person is a person who is thin or who is muscular or who just like someone who isn't fat, and that's not always going to be the case. A lot of times people who are excessively thin tend to be just malnourished and not healthy at all, despite what the standard for health seems to appear to be. So affected people actually also seek support from pro eating disorder websites, and these are just like websites that promote eating disorders. Like there are websites that promote being anorexic or bulimic, and people on these websites actually discuss tips and methods of hiding this from their like family members so no one will find out about their lifestyle. And people will use this as an excuse that it's just them seeking for support and for people like trying to raise their self-esteem, but really these websites are just really damaging.
Besides diets, there are also different ways to achieve weight loss, one of these being bariatric surgical procedures. These are known as weight loss procedures. What they do is they cause weight loss by lessening the amount of food that the stomach can hold, causing malabsorption of nutrients. The people that mostly seek these procedures beforehand have to reach a BMI level of between 30 to 35, basically categorizing them as obese. There are oftentimes success to these surgeries, between 50% loss or more excessive in body weight, and they maintain this level of loss for at least 5 years.
The most rapid amount of weight loss that they achieve are between 18 to 24 months after their procedure, in which they lose 30 to 50% of their excess weight in the first 6 months. The way that they reach this weight loss is because these surgeries change the digestive system. Common bariatric procedures are known as gastric bypass, sleeve gastrectomy, gastric band, biliary pancreatic diversion with duodenal switch. So, for example, a gastric sleeve surgery would be when they cut off part of the stomach, in which the patient will then be eating much less, which causes rapid weight loss. Many people find this as successful, but obviously with any kind of surgery, there are always risks and complications that come with these elected procedures. Oftentimes, procedure complications could vary by the procedures. For example, here are listed 2 common procedures that we see, and these are the complications that come with them. So the first one is gastric bypass, which often can lead to complications of breakage, gallstones, or hernias within the body, internal bleeding or profuse bleeding of the womb, leakage, perforation of the stomach or intestines, bowel obstructions, also pulmonary and or cardiac problems, which can come from any surgery, skin separation, or stomach and intestine ulceration. Most of these have to do with the abdominal area because this is where the surgeries are taking place. A gastric sleeve also can cause blood clots, gallstones or hernia, internal bleeding or profuse bleeding of the womb, leakage, perforation of the stomach or intestines, skin separation, stricture, and vitamin or iron deficiency. The vitamin and iron deficiency comes with the lack of nutrition that the body is receiving after these surgeries. Oftentimes, people that do go through with these surgeries do not really think about vitamins or supplements because they are eating much less. They have to be smarter with what they eat. Next are medical complications that often come in the long term after these surgeries. The first one being malnutrition. Oftentimes, malnutrition occurs because there is a limit to food capacity because of the surgeries. So this causes deficiency in iron, calcium, vitamin B1, and vitamin B12. So this comes because obviously when a person is eating much less, they're not being as smart. Like I mentioned in the previous slide, they're not being as smart as what they're taking into their body. So if they are not eating as much, their body begins to have deficiency in different areas of either the vitamins or iron and stuff like that. Stomal stenosis is a condition that can arise after these surgeries. This causes vomiting after eating or drinking. Oftentimes also patients will feel like they have acid reflux. It comes with the much smaller set of like their intestines or their stomach, depending on what surgery they chose. The next complication is dumping syndrome. So early dumping occurs 15 to 20 minutes after eating. So symptoms include bloating and abdominal cramps, nausea, heart palpitations, rapid heartbeat, and sweating, dizziness, or fainting. So this happens like right after eating. They feel like they have to go and throw up what they just ate. Late dumping occurs 1 to 3 hours after eating. Symptoms include hunger, confusion, fatigue, sweating and heart palpitations, tremors, and fainting. So this all comes with dumping syndrome. Perionitis can also be a complication that can arise from these surgeries. This is when the stomach leaks, causing perionitis, which is the inflammation of the peritoneum. Symptoms include fever, increasing abdominal pain, back pain, pelvic pressure, hiccups, unexplained tachycardia, which is the rhythm in the heart, and restlessness. So all of these are complications that can come with any of the surgeries that were listed, before on the previous slides, which is why doctors take very seriously when people elect to have these surgeries. They have to meet a criteria, and a lot of these complications are based on the patient's age, their weight at the time, and also depending on the way they take care of themselves after, their condition and their health, and then the ability to exercise, as well as the commitment of the patient to follow the doctor's orders. If a patient is not continuing up with their follow-up care, then obviously complications will occur.
Overall, not everything is as it seems. Representations of these diets and products may not be accurate and do not fully disclose the risks behind them. For example, the celebrities promoting these diets and products do have professionals that help them, and they do not fully disclose what else they are doing in order to achieve their weight loss. Given this fact, you should always do your research. Look into what is right for you and your body. The keto diet and the Atkins diet, although extremely restrictive, do work for certain people, and if done correctly, can be done without harming your health. This leads to the conclusion that you should always consult doctors, dietitians, and any other professionals so that they can help you achieve the results that you want.